everyone, it's Dr. Furula here. Today we are going to continue our talk about high cholesterol and hyperlipidemia. As always, don't forget to follow us on Instagram and subscribe to our YouTube channel at Carmel Medical. So on last topic, we talked about what exactly hyperlipidemia is and how we get diagnosed with it. Today I'm going to tell you what food we should eat, what food we should not eat, and what medications are good if, God, unfortunately, you have high cholesterol. So the group of foods that are big enemies for people that have high cholesterol, and they should stay away from it, because usually when you get diagnosed with hypercholesterolemia or hyperlipidemia, the doctor usually gives you about 3 to 4 weeks to watch your diet and see if we can manage the high cholesterol with just diet and not adding medication to our regime. So the foods that are big no-no are red meat. The more darker the meat is, the worse it is, and the higher the LDL will go. So try to stay away from meat, or at least have it once a week or once a month. The second group of foods that are really bad are dairy products, especially cheese and ice cream. Yogurt and milk is not that bad, especially with the lots of variety that we have out there. Low-fat milk, low-fat yogurt, you can get those and they're pretty good. But make sure you watch the sugar content on those and they're not high in sugar, because things tend to get low fat and they get high sugar, because that's how they make the food yummy out there. However, if you are really craving cheese and you still want cheese, there's one cheese that is still safe to eat, but not unlimited to the right portion, is going to be cottage cheese. So you can still have a little bit of cottage cheese and get that craving out. Ice cream, as always, is not good, but it's okay to have 1 or 2 scoops once a week or so, as long as you have exercise, so you can burn out those excess cholesterol. And just like any other disease, exercise can help a lot. If you try to stay active and get rid of that excess amount of fat, trust me, your cholesterol will get better with the weight management. However, if they do everything, you watch all you eat, and your cholesterol is still up, there is a big group of medication that I'm sure that you guys have heard all about it. There are statins. Statins have reduced morbidity and mortality in millions and millions and millions of patients. They are not as bad as a lot of people think they are. Yeah, they do have a side effect profile that they can elevate the liver enzymes. Very rarely, they can destroy muscles, but that's why when the doctor puts a patient on a statin, they will ask them to come back every 3 months and they will do a blood test. One, they want to monitor the cholesterol and make sure the statin is working properly. And second, they are measuring the liver enzymes and the muscle enzymes to make sure muscle is not breaking and liver is not getting damaged. So that's it. But trust me, if your doctor decides to put you on a statin, don't argue with them and take them, because they will save your life. They prevent myocardial infarction, heart attack, and stroke. Now, if your triglyceride is up and the LDL is not too bad, you need to watch our carbohydrates. And weight management helps a lot with managing triglyceride. So try to stay away from so much bread, rice, and starchy foods. And again, weight management will save your life. If you have a high triglyceride, that can eventually lead to diabetes, and you can end up with that. And there are medication, as well as a statin, can help lowering triglyceride as well. So if your doctor decides to put you on those medications, don't argue with them. Take them, listen to them, and follow up with them. As always, remember that exercise can help with any disease. So try to squeeze at least 20 minutes a day, and it will benefit you a lot. One more thing I want to tell you guys, that when you do a blood test to monitor your cholesterol level, there is a value that is called total cholesterol. A lot of people will freak out because the total cholesterol is up. Don't pay attention to that number. Go and read the individual values for LDL, HDL, and triglyceride. Sometimes some lucky people, their HDL is high, and that's why their total cholesterol is high. And that's not a bad thing. That's actually a good thing, and you should be happy about that. As always, again, if you have any question or comment, or if you'd like us to discuss a certain topic that you would like, let us know and we will be happy to help you. Have a wonderful day.